right. Hi, everybody. I am Dr. Amy Nelson, and today I thought I would do something kind of fun because thank you, everybody, for yesterday. I posted a couple videos from the Capitol because we had a little lobby day. The Texas Naturopathic Doctors, which I'm the president of. It's called TXAND, Texas Association of Naturopathic Doctors here in Texas. We're trying to lobby to get Texas a licensed state. And today I thought I would just kind of talk about that because it was something that we went to the Capitol yesterday to talk with a few different senators who we thought could sponsor our bill. And I guess I'll just kind of explain what we're doing. Hello, Vanessa. Good to see you. So, usually I do this little Wellness Wednesday and we talk about kind of a fun little topic, the thyroid or whatever. But today, we're going to talk about what I was up to yesterday at the Capitol. Naturopathic doctors, I'm sure maybe some of you know, some of you don't know. We are primary care doctors. Like, we've been trained as primary care doctors. And here's our little map. So in all of the blue states, we are licensed as primary care doctors, where we can act exactly like you would expect a primary care doctor to act. So you go in and we can order basic labs, we can, take your case, we can do physical exams. We are trained in that way. And that's where we, when we went to medical school, we received that type of training, right? So naturopathic doctors, we receive a lot more training in nutrition and kind of understanding different modalities that can add to what we call preventative medicine, or to help you truly not develop into a chronic illness condition. And we also get training in pharmaceuticals. So we do have a formulary that we can refer to. We have a lot of pharmacology training. We also get drug-herb interaction training. So we have a lot of that knowledge base. So we have a lot of tools in our toolbox when we look at chronic illness. And so we like to assess the root cause of illness and then help with, managing lifestyle, to try to improve health outcomes. And that's where our approach to medicine comes from, is to truly, help somebody stabilize so that we can have, better chronic condition outcomes. So we don't have such a burden on healthcare. So we don't have people, not making changes so that they are only reliant on surgeries and medications and all that kind of stuff, because it's very expensive for the healthcare system. Not only that, is we really want you to get better. Think about, myself and, managing things before they become a problem. And I want that for everybody. So naturopathic doctors, that's our focus, is to really treat the symptom, or to understand the root cause of illness and not just manage symptoms, but to really find healing outcomes and to work in that medical model. So here you can see the states in orange are the states that have actual bills in place to go for licensure. So we are licensed in, I think it's 22 states. And then of course there's, the Virgin Islands and things like that too. So it's like we have licensure in 22 states. We are seeking licensure in like these other states that are orange here. Texas is one of them. And so we are looking for a bill sponsor to help pick us up. We want so yesterday when we went to the Capitol, we talked to a couple of different lawmakers and had some positive response. We're, of course, going to go back and kind of, try to, get some attention and get some support. But I thought I would show you kind of what we presented lawmakers with. So our first kind of page, and I'll post these all in this Facebook Live But here, this page is basically it's the page that describes us as primary care doctors. So naturopathic doctors are primary care doctors, and it gives our education. So we, of course, and we've gone through this on a Facebook Live before where, we all have our 4-year degrees. So, and usually you're going to have some type of science-based degree or something like that. And then you apply to go into medical school. And so there are accredited medical schools that are naturopathic. Mine was NUNM. And there's a list here. There's Sonora, and then there's SCNM, which did change its name, and then Bastyr. So these are the big kind of, probably the main schools that we have. It is it's a doctoral program, right? So we go in, you have to meet basically criteria, having taken so many hours in chemistry and organic chemistry, biochemistry, genetics. Usually there's anatomy, physiology, there's criteria that you have to meet. So a lot of times you have to, in your degree, you've had to meet those prereqs. So then you apply and you go through a interview process, all of it. You send your transcripts in. It's one of those, and then you get selected. And then now you're in that program, which the hours for that program. So here, the ND and the DO and the MD programs, and I'm reading from this. The total credits for the MD program is 288. Ours is 300 credits. So we actually have more credit hours because we take additional, biochemistry for understanding nutrition and that kind of thing. We have pharmacology specific credits are about 13.5. The MD criteria there fluctuates. So in this particular graph, it says unknown. The DOs have 5 pharmacology specific credits. So that just kind of tells you a comparison. PAs, for example, have 6. Nurse practitioners have 5. So you can see we do get a lot more credit hours in pharmacology because we are studying that drug-herb interaction. Our residency requirements are where, people say, well, you don't have to have a residency. Well, we would like a residency. So remember, residencies are paid for by the federal government. And so naturopathic doctors in our program, our residencies have to be paid for from either our schools or private clinics. And so that, puts a strain on things because residencies are expensive. So we don't have access to the same federal dollars that the medical doctor programs do. So we would love those residencies and be able to offer one for every person. So when you graduate, usually you go into an associateship program. And that's what I did. I did my associateship at the IBS Treatment Center in Santa Monica. And I did that for over a year. So that is the big difference between the schooling of a naturopathic doctor and the medical doctor schooling, right? So in Texas here, we went in, with this information to try to help, the lawmakers understand where we're coming from, because my same CE, so you have continuing education as a doctor. So I still am licensed in California. Texas doesn't have a licensing program, so I just kept my California license. I'll probably also have a Montana license soon because I have a lot of family up in Montana, so it makes a lot of sense for me to be licensed actually in a couple different states. I also have, family in Kansas, so who knows, one of these days I might pick that licensure up too. So I will maintain the continuing education for those states and their requirements. So usually California is 60 continuing education hours every 2 years, and 20 of those have to be pharmacology hours, which is really similar to how a pharmacist is actually, the same kind of credit hours a pharmacist has to have. So I like to point that out because we maintain a lot of education to do what we do. In states like California, in Montana and in Kansas, which are licensed, we can, practice primary care. And what does that mean? Well, we are very well plugged into different kind of referral systems. So for me, if I have somebody who's trying to manage their blood pressure and they're trying to do that with diet, exercise, you know, all that kind of stuff, and it's not going well, I actually look at trends a lot more carefully than somebody who just goes into the doctor once a year. So when I can see something isn't trending well, then I make the referral probably sooner than later with a bunch of information so that that cardiologist can have a better outcome helping this patient, and maybe they can get on a more accurate medication protocol. So you can see we practice really, really well together because we are usually looking at, we're trending things a little bit more tightly. We're also kind of monitoring that patient a little bit, you know, more than just, you know, having somebody come back once a year and leaving them to their own devices for a year, but then having them suffer with cholesterol issues or blood pressure issues that are being poorly managed, you know? So what we want is for people to kind of stay out of the ER, right? Unless they need to. Go to the ER if you need to. But we don't want the ER to be the primary care doctor. That's where a lot of drain on the healthcare system happens, is if I am not being poorly managed on my own or in primary care, and then now I'm in health crisis and I go to the ER for my care management. That's very, very expensive, and it actually congests the ER system. I don't know if you all remember my story. What was it? It's been a couple years now, but I was in Kansas visiting my sweet family and I had an appendicitis. I woke up in the middle of the night. I was very, very sick. I thought I had the flu, you know, it was just one of those things. And then later that day, I start having the signs and symptoms of an appendicitis, and I couldn't believe it. I was like, what okay, guess I'm having an appendix problem today. And so went to the first ER, called my mom. I'm like, hey, this is happening. I think I'm having an appendicitis. And so we went to the first ER, and oh, bless her heart, that the lady who was running the ER that day, or the admission, was very stoic. She was very flat. And so I waltzed into the ER with, you know, couldn't even stand up. And I'm very, I'm one of those that I can take a lot of pain, you know, so I said, I'm having an appendicitis. I need some support. I need to get in. And she looked at me just like this and was like, it will probably be about 3 or 4 hours. And so you can have a seat in the waiting room. And I literally said to her, I think I'm going to be passing out in your waiting room. And I'm too sick. I'm very sick. I know I'm having an appendicitis. And she said, well, you can go to another ER. And luckily I had my family with me, because I was like, we have to go to a different ER. Otherwise I was like, do I have to call an ambulance to this ER to take me to a different ER? So it was that ER was, I don't know what the deal was, but I couldn't get in. And by the time I actually had surgery for, my appendix had started to rupture. And so my body, for some reason, fused it to the wall of the abdominal cavity. Thanks, body. But yeah, it was fine. You know, it was what it was. But I was just like, am I dreaming? You know, it was definitely, I was turned away at the ER with an appendicitis and told I couldn't get in, and it was going to be a few hours, and I was already like not good. Anyway, that said, that's my story about how we need to not be using the ER for primary care, right? And so that's where naturopathic doctors, especially in Texas, we want to play a role to help serve primary care. And this affects a lot of people in especially rural communities that may not have huge access to healthcare, right? So when we can provide more primary care services, then of course people can be managed much differently, and they have different health outcomes, so that we just have better, you know, luck being caring for each other, right? So there are, you know, here was a study that showed it is about a 70% health savings to the you know, I think it's a Blue Cross Blue Shield study shows 70% health savings when we use naturopathic doctors for primary care, because we're holistic and we like to look at, you know, like I just mentioned, we trend things a lot more. And then we also look at different ways you're making those habit changes and ways that we are, you know, finding success. We trend things a lot more. Like the people come to see me, like I'm running parameters like every 8 weeks, every 12 weeks, you know, and then we are tracking symptoms. Are we getting better? You know, and so we really want to be onto that road to recovery. So here, So this page, I will, I'll put this up here because we're trained as primary care doctors, like I've mentioned, family practice medicine. So that's also what we're trained in. So we can see all ages, so we've gone through that kind of training as well. We establish care with patients who do not have prior history of care or diagnosis. So we're often like a real safe person to come talk to. Like I get really happy when my patients are like, this isn't like the normal doctor's office, so it's not intimidating. It doesn't have that factor to it. I want it to feel very safe and very conversational. And, I don't want somebody to, run out of here screaming. So anyway, so that's always a goal. So we manage ongoing primary care. So we are, we're trained to diagnose and to treat, and in states where, like here in Texas, I'm a consultant, so I can't say that I diagnose. I can't say that I treat. I have to really respect that situation, which is fine for me. Because I work so well with other care management systems that they're usually coming in having seen the medical doctor and things like that. So in our world, we're really, really good at plugging into the system and helping outcomes, so there's not any of that, like, do what I say and not what they say. That's not how this goes. We actually want to, provide a really good team approach so that somebody comes in with their health issue and can have, really good options. And they kind of guide it a lot of times. So for me, if I have somebody who comes in and they have to make some really serious changes in their nutrition, or they are looking at a med protocol, let's say it's cholesterol. So we give it a time frame and we run it just like we would any other observational experiment, right? And you would say, okay, is this improved with these health parameters at this period of time, right? And then you get to really say, okay, was this easy for you to do? Was it successful? So a lot of times people will come in and they'll have issues because they may not be able in their life to make that change. And that is okay. I have no shame or blame on that. Like I myself, how long it took me to get my habit going with exercise? It took a long time and it just was what it was. It's okay. So then you really get to help that person understand that this medication protocol that you need is going to be useful for this period of time, so then you can help guide them onto that. And maybe a lot of times people don't want to be on the medications because they feel like they can manage it. But when you really show them like their timeline and what we're seeing, let's do this other idea that you've been prescribed by your medical doctor for a period of time. And then let's look at the health parameters. And then if your goal is to get off that medication, good. We could, help you with the habits that have to be in place so that you can do that. Right? So it's really to kind of like guide them in a way, so you're really helping them make a safe choice for themselves, right? Because if we weren't there, then oftentimes they may ignore their medical advice, go on with their habits, go to the internet, and get some ideas, which the internet, sometimes there's great information. Sometimes there's this information that makes me feel like I'm watching an infomercial, right? So you might not know what the true, like, what is an anti-inflammatory diet? What's the anti-inflammatory diet that's going to work for me in this situation? That is hard to figure out with just you and Google, so it's useful to kind of like have somebody guiding you through that, because if that's happening, then your chances of probably having a major, say, cardiac event are probably up there. So it is one of those things where if you have somebody like us helping you with that, that helps a ton, because then I can kind of guide you through that situation and, understand your prerogative and what your goals are, because it's your body and you're a person. And so if we're saying, okay, you don't want to take those meds and you want to do this with diet and exercise alone, cool. We're going to work this. We're going to retest some parameters and see if things are improving. And then we've got that data to show your doctor, and then now we've got, something going on where you're just not let loose into the world with you and Google. No, So anyway, that's how we keep the healthcare costs down, right? So then that makes more sense. If we've got people who are actually improving their health outcomes, we have a healthier herd of people paying into health insurance, right? So health insurance works that way. You need more people healthy paying into it so that you can have the volume of dollars to take care of the people who are sick, right? So let's see here. What else is on this thing? Oh yeah. So it just kind of goes through like kind of our training. So like I said, I'll post this, on the, in the section down below. And then this is just the stuff that we presented our lawmakers yesterday. Here's a wonderful top 10 reasons to regulate naturopathic doctors. Let's see. So 1, prevention and lower healthcare costs, like we mentioned. And here's the footnote for that. Whole person care. So we're very holistic. It's not unusual for me to be talking to somebody about digestion and talking about their hormones and their nervous system at the same time. You know, you've watched some of my content, right? So hormones and the nervous system are best friends. The nervous system and the digestive tract are best friends. You know, the thyroid and your adrenal system are best friends, and hormones, right? So we're all tied together. We're all connected in that way. So it's very usual for me to be in one organ system and we're kind of understanding a different organ system. So we're not kind of like divvied up like that. So we're very, very holistic and whole person health. That's kind of what we're talking about. We treat the cause. We start to understand the root cause of an issue, you know, so that is also, you know, very useful when you're trying to help somebody out of their chronic health condition. We offer natural, low invasive care. Yeah, that's also like, so when we study botanical medicine and we study nutrition, and homeopathy is a type of alternative medicine, all these things are very have very, very few side effects. Or the way that, you know, botanicals can have side effects. We don't want to pretend that some of them are, you know, poisonous. So botanical medicine, because of our understanding and we understand how to use it, then we, you know, can give it safely, right? Yeah, we have strong education, like I just mentioned. We are pretty transparent. And so here it's to protect the public. There is a study here, and I'm going to post this as well. 99.7% of the 8,000 licensed naturopathic doctors practicing medicine have maintained a record free of disciplinary actions. So we're pretty good at, you know, protecting the public and maintaining safety and understanding all of that. So what is this? Additional primary care providers. Oh, so it's just going into our training as primary care providers. We provide synergy with medical doctors and DOs, just like I described, you know, so the patient coming in who maybe has a medical protocol that was recommended, but they're uncomfortable doing it. We're tracking it. And if we're not seeing the trending going well, then of course we're plugging into that medical doctor protocol, right? Or for us, if we're tracking somebody who has never been to the doctor and we're starting to see that a medical intervention is needed, then we get them into that system sooner than later. So it's very important. We understand drug-herb interactions. And then number 10 is patient empowerment. So it's, you know, to help advocate for patients, but then also help people understand just kind of, you know, how their bodies work and what our goals are, you know, so that kind of feeds into there. So I'll post that one. This one we've gone over before. This just goes over our training and our coursework and our requirements and things like that. So yeah, this is, like I said, I'm going to post this because this was just our legislative packet that we went in to lawmakers' offices and presented ourselves. And so here in Texas, we're looking for a bill sponsor. We have a bill that would give us the right to practice primary care. And we have to get picked up by a bill sponsor, which would be any senator or representative. You often need actual, like, other supporters as well. So you often need a couple of different bill sponsors. So that's where we're at with our situation here. And so what happens is, like, you can go to texand.org. I'll post that too. That's the Texas Association of Naturopathic Doctors, and you can sign a petition. You can write a letter to your lawmaker. There's a tab on that website is who's my lawmaker? I never know who my lawmaker is. I always have to look it up. And so you can write the letter. You can write a letter of your experience to say, okay, this is how this helped me. So that's, you know, kind of how our government sort of works. Texas, we're a little bit different in that our legislative session is once every 2 years. I don't know other states work, because I've got family in Montana. I kind of know a little bit of Montana's state stuff and a little bit of Kansas. But some states have it like that, where it's a once every 2-year session. So that's what goes on here in Texas. So yeah, I will put all that information so that you can kind of understand what that looks like, because if you're in a licensed state, you might see naturopathic doctors wanting to expand their scope and to get insurance coverage, so that happens too. So a lot of times there's licensure, and then they always want to try to expand the scope. So you might see some things like that here or if it's an unlicensed state like here in Texas, it's about getting licensure. So yeah, I don't know, I thought that would be just kind of fun. And so I'll keep posting those little videos from the Texas Capitol and I'll let you know kind of how it goes. I think our session goes until like May or something. It depends on if they have a special session, then they take it into the summer months, but it'll be exciting. It's always kind of exciting to do work like that, to see what you can do for expanding healthcare options for people. And so yeah, it's a neat adventure. I never imagined myself doing that, but it's kind of fun. So anyway, like I said, I'll keep my promise and try to post these documents, and then you guys can read them over yourselves, so you can kind of educate yourself about what a naturopathic doctor is and what kind of role we serve in healthcare. So all right, everybody, I'm going to get back to work. Next week, I would like to talk about the thyroid more. So I know last week we talked about it, but, or you know how it goes. One day I'll be like, let's talk about the thyroid, and then I'll get a wild hair and we're going to talk about something else completely different. So, you know how it is. But we will, I'll keep you posted, and then we'll go from there. So, all right, everybody, have fun.